Good evening and welcome to this our Family Month program for the 2022. We at First Assembly are very privileged that you have decided to join us this evening. And this year, as we always do, we've set aside the month of March as Family Month. And our theme this year is Arise, Build Families Which Honor God. And that is based on the scripture verse taken from Nehemiah chapter 2, verse 18. This evening, we will have a very special panel discussion where our topic will be family health. And I have with me my co host, Mr. Joel Lee, and we are also joined by other three medical doctors who Joel will now introduce.
Yes, thank you, Urson. Our panelist this evening is Kezia Lee. She is a medical doctor. She has a bachelor's degree in medicine and a master's degree in pediatric medicine. And with her, we have her lovely husband, Robert Lee. He is also a medical doctor with a degree in medical technology. And last but not least, Dr. Neil Trotman, who is the program coordinator for the National Malaria Program, and he holds a bachelor's degree in human medicine and a master's degree in public health. And now I'll send back to my co-host, Urson, as we begin our discussion here in the doctor's office.
Thank you very much, Joel. And as we kick off our discussion, I want to first bring up the whole question of wellness or well being, because even before we can start to talk about health and all the other things that go with it, we have to first of all ensure that we are well, we take care of ourselves. So that will be the first subject I would like us to start our discussion. And any one of you three can go first. Let's talk about what do we do, first of all, to keep ourselves fit and proper, as they say, fit and trim.
All right, so good evening, everyone. When we think about well-being, one good stand to think about is it's a look at it as a holistic approach. So this is body, mind, spirit, right? But speaking particularly on the body, it involves the kind of foods that we would eat. Simple things like exercise, how much exercise, the kind of exercise that you do based on your age. So I won't necessarily go and tell someone in their 70s or 80s, go and chuck a mile. Simple walking, those kind of things, just to get their heart rate up a bit. Those are some of the things we can think about when we talk about well-being, physical well-being. So we deal with exercise, we deal with the kinds of foods we eat. Um, those are some of the things I would want to punch in when we're talking about well-being. If I may, we even talking about the spiritual aspect, because we can't necessarily stay away from spirit. This is the kind of same thing again, kind of foods that we eat, what we feed our spirit with. So this is spending time in the Word. You practice the same exercise in terms of how you speak. You profess certain things over your life. So the well-being of an individual, we can't just say it's one part and not the other, but the entire human, the entire person, body, mind, spirit, it gives the full well-being of that individual.
I like that response, Dr. Robert. One of the things that, as we're approaching this topic of family health, there is both the spiritual, the physical, and one of the things we hear a lot about is diet. I mean, there's so many things, there's so much information available to us now, and we really need to know how do we determine if our diet is a healthy one or not.
Okay, good evening, everyone. So determination as to whether your diet is healthy or not. In school, we learned about your five food groups, and then they said the sixth was your water. So how you determine whether your diet is healthy enough depends on the quantities you receive those five food groups in. So let's start with your carbohydrates or your starchy foods as we call them. In your normal plate, the amount of starchy food you would want to have would be two fistfuls. So you look at your fist and you say, okay, this is the amount of starch I should have. But just remember that your starchy foods or your glucose or your carbohydrates includes your sugars as well. So you have to include the amount of sugar you add to the tea, the drink that you're drinking, the juice that you're drinking. So you take one of these fists and you put it behind your back. So you take that away. So on your plate, there should be this amount of starch. So that's the rice. Yes. I know that seems impossible for us Guyanese and Caribbean people. The other food group is your proteins. So the amount of that that you should have on your plate, and I'm going to use the hands to help us look at the measurements, should be the palm, the size of your palm, and the thickness of your palm. So that's the amount of protein that should be on your plate. Now, the amount of fruits and vegetables on that plate should be take both your hands, open them big, sprawl those fingers, and that's the amount of fruits and vegetables that should be on the plate. Now, if you think about what I said, the largest quantity is actually the fruits and vegetables. Now, we're missing something your fats and oils. So, your fats and oils, see this little finger? Now, this little finger, look at the nail. That's the amount, this nail size is the amount of fats and oils that should be in your diet. And of course, it's recommended that you drink at least 8 glasses of water, 8 ounces of water, 8 ounces in a glass, 8 glasses per day. That's for one person. You can drink more, and that's to keep you hydrated. That's my take.
That
Wow,
diet will
wow.
definitely pack a punch.
Well, I've got a quick question here for well, first of all, let me make a statement. Obviously, I'm eating in a very unhealthy manner, and I'm sure many of us do. But I noted that just now Dr. Kezia mentioned different amounts, and she gave the amount of the different food groups that we should eat. I have a follow up question. Do we have any variation for persons who might be suffering from different chronic conditions? Like, for example, if somebody might be suffering from diabetes, or we call it sugar, the local language. Do you have some variation in terms of how the plate should be laid out if you are suffering from certain conditions, or is it one size fits all?
A lovely question, Brother Orson. I was actually going to touch on this point a bit because while we have a lot of, and I love the presentation that Dr. Casey did in terms of the quantities of food, um, persons suffering with different illnesses may vary, and it may never be the same fit for all. And I'm going to touch a bit on the diabetic patients, for example. We tell the diabetic patients that they should include their meals at least 6 times per day. So they should have small quantities of meals 6 times per day. So it is not a case whereby they cannot eat the same food as everybody else, but their quantities, the same quantity that Dr. Casey had just laid out, is just in a smaller portion. Now, especially for the diabetic patients, they need to take strong care with their carbohydrates because a lot of persons have the conception, oh, I'm not using sugar, so therefore I am safe. But as Dr. Casey just explained, carbohydrates, when ingested into the body, that is converted into sugar. So lots of time you find persons with high blood sugar after meals, and they're saying, but I didn't use anything sweet. But it's the simple carbohydrates.
And similarly, for persons who trouble with high blood pressure, um, they need to be very, very careful in terms of the amount of fat and oils that they use, the amount of salt and sodium that they use within their diet. And so is advisable is that if you trouble with any particular illness, be it high blood pressure, be it sugar, high blood sugar, be it any heart disease, that you ensure that you talk with your doctor to get the right regimen, the right treat, the right meal size, the meal proportion, and what you need to consume and what you need to eliminate from your meals in accordance to whatever pathology or illness that you have.
Very informative, Dr. Neil. Now, you said that you recommended that we speak with our doctor. Now, in Guyana, we have a culture where we speak with the doctor when we're far gone. Means that we're just a stone throw away from Jesus, so to speak. And that is a cultural norm. We're not speaking to our doctors, and we're not taking the advice of those who have the expertise in that area. So how as families, how do we know s- navigate in terms of making that correcting that thinking first and foremost? Because it's not just visiting doctors. We also have issues in our culture where people are, you know, they're the community doctor, so to speak. No, they never went to any institution, and now they're, well, you have a little pain, you broke a bone. Okay, well, just buy some antibiotics so you can be all right and drink it. So how do we now start to deal with those cultural issues where we're not, it's not a part of us in terms of our thinking to speak with our medical professionals to get their advice as it relates to our health as an individual and even within our families.
All right. What I want to say for that, we should start looking at health and it's a positive standpoint. Just like how every year most families or most persons they would plan for a vacation time because they think, okay, this is you in January, you're planning vacation deep down in November or December because you say, I deserve it, I worked hard this year. Think of health or checkups in the same manner. I would always want to say, as a family especially, you can plan to have yearly checkups. You don't resort to going to the physician or going to the hospital only when you're ill. And even dare say our society is of such where it's not just when you're ill, but when you're ill and like you've exhausted all these other options where you can't do anything for yourself. That's not necessarily the best um, position to take when we're thinking about well-being as a family, as an individual. But it's building that relationship with your physician. So you make yearly checkups, set aside some time, everyone in the family just have checks. So you always know a positive position where you are. It's like they always say, prevention is better than cure. So once you're taking care of yourself, you get good advice from your physician. You know exactly areas in which you should look at. This year, you might go and say, okay, my cholesterol may be a bit high. The doctor may be able to advise you stay away from this kind of foods. You should just mind how you eat, exercise a little bit more. You're gaining weight here and there. So prevention is the best way forward. As a family, always plan doctor visits, not only when you're ill.
Additionally, Robert, I saw a meme. I just wanted to share this. I saw a meme. When persons have medical issues, they go to the lawyer. They have somebody rob them, they go to the police. When they're ill, they go to Google, they go to their cousin, they go to the OB house, they go to grandma, and then when none of that works, they go to the doctor. I just wanted to hit home that just just as how those other persons serve a purpose, and
Exactly. Okay.
just as how those other persons serve a purpose, we have to recognize that our physicians serve a purpose as well and use them for that purpose.
Well, I laughed a lot because at least I know from my perspective. Let me be very specific which category I fit into. I'm in the category where when you're ill, you try everything, try to take whatever tablets that you might have in your medicine press, as we call them, and or bear up as much as possible, leaving the doctor as the absolute last resort because you always feel, well, tomorrow it can be a little better. I think that's something that affects. I think we as men, especially, we kind of have a fear of a doctor. I know Dr. Robert just advocated that we should go and do annual checkups, but we sometimes prefer not to know, or I guess we really are afraid of what we may find out. But I certainly agree that that's very good advice, that we should have ourselves checked out. So I'm thinking now is probably a good time for you to give us an idea as Guyanese in our culture, because every culture is different. As we go around, every nationality, every region has its own sets of ailments. What are some of the common things that as Guyanese we should be concerned about? Why should we go and do these checkups? What are some of the things that we are likely to find that we are suffering from, although we may not know it?
I love that question, and it all comes back to what we were discussing just now in terms of diet. If you look at the Guyanese diet, we love ourselves the barbecue, we love the Chinese, we love ourselves the KFC, we love ourselves the churches and the fish fries and all of. So when you look at those things, primarily all you're seeing is fat, salt, and more fat. So when you look in that direction, you can identify very early what are some of the diseases that we see commonly. High blood pressure, high blood sugar, heart disease. And when we talk about heart disease, we talk about, for example, persons having minor heart attacks, or as we call it, MIs, person having strokes as well as some as we would call it on the layman's term, and then you also have other diseases that will affect not only your or your lungs, but you have things like, for example, gallstone that you hear a lot of people talking about, but you don't really know that it's really caused by sometimes lots of the dietary things that we consume on a daily basis. um, Besides all of that, you have all of these varying issues. For example, genetics passes down different diseases that a lot of persons are not conscious about. And you have things, for example, like cancer. You have things, for example, let's talk specifically if you're looking at male, let's look at the prostate. How does that affect? And it's not only prostate cancer. You have other diseases like, for example, prostatitis that a lot of men are not aware of. You have, for example, in the women's cervical cancer, you have breast cancer that we talk about very often. And so these are things that are common, but because persons tend not to look at it, that you find that it sometimes goes unnoticed until it's really, really late.
Well, Dr. Neil, you just spoke about the fact that sometimes these things go unnoticed. What, as doctors, we have a panel of doctors here. I mean, you mentioned things like heart disease, high blood pressure, diabetes, and the various cancers. I guess you can pick some of the common ones, and you can take it in turns. Give us an idea as to what are some of the telltale signals, because we all should know it, and it's not a case of as a man I should only as a man I should be knowledgeable of what are the signs, for example, of prostate cancer. It is useful, for example, for my wife or for women folk to also be aware, especially for the men, because we will always be denying the signs. That's built into our nature. So if you, as doctors, pick some of those popular conditions that we have and give us an idea as to how we can know that we are suffering from these conditions.
All right. Um, I'm going to start with diabetes, sugar, as you call it. Um, and a lot of people say that, this is when you use enough sugar and you got enough sugar in your blood. True. It is caused by an elevation of your glucose levels, which is the sugar in your blood. Um, but it has a genetic cause as well. And most adults that suffer from diabetes, they have a genetic predisposition, which means somebody in their family would have suffered from it. So if somebody in your family suffers from it, then that means that you should look into whether it could be possible that you are in early stages, you have the disease, or if you can progress towards the disease. Um, Signs to look for in the disease, things like weight loss. And weight loss is a sign, it's a general sign, and it can indicate not only diabetes, but many other illnesses. Frequent urination, you going to the washroom too often. Frequent thirst, you're thirsty, you're drinking a lot of water, and then you need to go to the washroom. Skin rashes or breakouts on the skin that don't heal as easily. Blurred vision, you're not seeing well. You used to see fine, and now your vision is blurred. You're getting headaches, you're feeling dizzy. And if you listen to the symptoms I'm calling, some of them are very general, which is why it's important that you get checked. Now, what do we do if we find that you are suffering from this disease? You are put on treatment, and treatment does not only entail medication, because you will be given medication, but treatment also entails exercise and diet. The doctor will put you on a schedule, have you speak to a nutritionist, somebody who can help you with your diet, and ask about the type of exercise that you're getting. And walking for 20 minutes to half an hour, 5 days a week, that is considered enough exercise to help.
I would want to touch a bit on heart disease, because I think one of the things that we will realize as we go through the discussion is that a lot of these illnesses are, um, they affect the individual, but they have external components that actually can provoke or increase the risk of having them. Heart disease, for example, we can talk all night about the diet, the sodium, the too much of sodium using, too much of fat using. But there are also other risk factors when it comes to heart disease. Heart disease can also be exaggerated, or the chances of developing it can also be greatly increased if persons are experiencing, let's say, for example, a stressful situation, if they're in a stressful environment. A lot of times we find that persons, as a whole, they depend not only on the nutrition, but they depend on the support of family members. They depend on the support of their siblings, their husbands, their wives. And you find that those kinds of environments can cause your stress level to raise if you have problems continuously that are not addressed. That can also increase your risk for for heart disease. Heart disease is something that a lot of times comes in very subtle ways. For example, may come to may say, seeing that I have in my legs. Every time I walk, my legs swell. But when I lay down and I relax, it goes back down. But as soon as I get up and I start walking again, that happens. Some persons may say that I have this pain in my chest that it goes and it comes. Some person may say that if I walk for a certain distance, I feel my heart beating very fast, like it wants to come out of my chest, or I may have some amount of shortness of breath. I have trouble breathing, and all of these are signs that you really need to have your heart and your cardiovascular system, or your circulatory system, as we would put it, checked out.
Okay, and can somebody touch on some of the popular cancers, for example, that we have? What are
Yeah,
some
well,
of the telltale
yes, and also as we're on cancers, I know that cancer is the word cancer is the most feared word in 7 languages. So so most people, as soon as you get that diagnosis, it's like, okay, let's have the last hurrah. This is it for me. And but could the or medical experts bring some clarity on this? Does it mean that once someone has been diagnosed with cancer, that is the end?
I think to answer that question, cancer, it boils back down for me. It boils back down to your regular or annual checkups. It's all about the timing. I believe catch it early, your prognosis is a whole lot better. So you start experiencing things. We spoke about weight loss, loss of appetite. When you start going to the in particulars in cancers, as a man, I would want to start screening for prostate cancer. I want to get over the age of 40. I know prostate cancer is a feared thing for a lot of men because once we hear prostate cancer, we start thinking of the digital exam, which kind of be intrusive, but there are other methods and ways that can be done to screen in terms of screening for prostate cancer, knowing the genetic basis in your family, for example, so you know what you may be predisposed to. So letting your physician know these kind of things. So okay, they'll you have, for example, colorectal cancer, for example. You let them know this is why it's happening in your family. You had a cousin or uncle, someone in your family may have suffered or died from it. So they know the kinds of screening that is done. So that once catched early, proper correct treatment can be done. So it's not, oh, I have cancer, this is the end of my life. That is not the case. Cancer is not an automatic execution. It can be treated once catched early. So you pay attention to your body, pay attention to the changes in your body. We always know when something is wrong. I believe even if something seemingly may may catch you off guard, you always know beforehand. Pay attention to your body. Your body always lets you know what's happening. You as a man, for example, you go to urine and instead of one stream you have a split in your stream of your urine. Something as simple as that may indicate that your prostate probably has started to enlarge. These are things or your wife, kids, you might notice when I get older I'm going to the washroom in the night a little too frequent. She's saying, no, Robert, we should probably go and get this checked out, see everything is okay. Urination, the frequent urination can be a telltale sign of so many different things. It's quite important that we don't just um, dismiss things. I know Erson talked about you want to try a whole lot of different things, trying to put off in the hope that you'll feel better the next day. Uh, I would want to advocate and say investment in your health is a really good investment. It's the payback for that is can't really talk about it, but invest in good health. Listen to your body. It's always good things, especially when you're talking about cancer.
Thank you very, very much. I think that's definitely very good advice, Dr. Robert. Listen to our bodies. So, women, if you feel that lump, that much I know, but breast cancer, you should, that odd feeling lump, you should go and have those things checked out. Um, one, one thing I want to raise now, I know certain diseases um, like can lead to other complications. So, for example, if you are hypertensive, that can cause other complications to come. And the reason why I'm raising this is because you to I want to give you an opportunity to emphasize why it's important that if we know we are hypertensive, for example, why we should have it treated. Because if we don't treat it, what else can happen to us, or what other deteriorations we can see in our bodies because we left, for example, hypertension untreated?
Um, so hypertension in the medical arena, it's known as the silent killer, and there's a reason for that. In most cases, you don't even know you're hypertensive, and in a lot of the cases, even if you know, there are no symptoms. I know people say, "Oh, I know when my pressure high, the back of my neck is hot, I get headache." Yes, those things can happen. And some of the symptoms are the headaches, the pain behind the eyes, the back of the neck hurts, dizziness, you see and blurry. But hypertension does not always come with symptoms. And you could be fine today, and then later in the day, you're not. And it just happens abruptly. And this is because it has effects on so many other organs in your body. That increase in the in the blood pressure increases the flow to all your other organs. So there can be damage to the brain by means of a stroke. There can be damage to your kidneys. There can be damage to your liver. There can be damage to your blood vessels because they have to support the pressure flowing through them. So it's very important. It's very important to know, and not only to know, to receive the treatment, because knowing is not enough. And knowing the treatment or having the treatment is also not enough. But receiving the treatment, using what is given to you, and taking the advice that is given, it's very important.
Thank you, Dr. Kizio. I'm glad you mentioned that point there about taking treatment because in Guyana we have a lot of things that happen within our culture, like we mentioned earlier, and there are cases where a doctor has prescribed you need to take this medication for a period of time. And most Guyanese, by day three, we feeling good. So we leave the stuff in the medicine chest and we're okay, we feel okay. But so the other treatments that we were supposed to take, we don't take them. And then a neighbor has an issue that sounds similar to what they had. They say, well, I got these tablets here. Why don't try it? And you give your friend, your neighbor, the tablets and you're not a doctor. You have not completed your medication. So that is another thing that we find very very common in our culture, where you got a doctor, they've given you medication to take over a period of time, and we've chosen to. After 3 days, I good man, I good doc, I good. And what happens to the other 6 days you were supposed to take the medication?
Excellent observation, Joel. And there are a few points I'd like to touch on. So, the diseases we've been discussing tonight are called chronic diseases. And chronic means that these are diseases that, once diagnosed, barring a miracle, they are with you for the long haul. So, when prescribed medication for these diseases, it's important that this medication be used consistently. That is the only way that the disease can be, that you can get it under control. That, in addition to all the other treatment options that your doctor has given to you. Your medication is your own and should not be shared. You should not give your medication to your neighbor because you think they're experiencing the same symptoms that you are. Because you are not a physician and you cannot rightly or you cannot accurately diagnose them. You do not know what they have. Your advice should be go and get yourself checked, find out what is going on, and let and somebody with a degree treat you.
Well, thank you very much, Dr. Kizia, for that answer. But I want to throw another one in there in terms of our cultural practices. you mentioned about us not having degrees and we wanting to play doctor, but how about when we say, I think I got a little infection, I feel a little burning. So I go around to the pharmacist, give me some of the black and red antibiotic, and I got a little infection. I want it can help me get rid of it. And some of the pharmacists do give us those capsules. Could you please speak to the whether that is a very good practice?
I love the idea that you brought forward in terms of going to the pharmacy and just and telling them what you want, what is happening to you. So in actuality, it's not the pharmacist with the degree; it's you with the degree telling the pharmacist what you want. However, the pharmacist has the idea. They have ideas as in terms of medications, the purpose of the medication, what they're used for, how they should be used, what are some of the indications, and when they should not be used. They have the idea. What or where the problem comes is that the pharmacist may not have the means of diagnosing exactly what is happening with the patient. And so you have a case whereby lots of times the pharmacist, in a good heart, is willing to help patients by giving them medication. And I'm going to use antibiotics for this example. A person may have a infection. They get burning when they urinate, so they go to the pharmacy and they say, "We want the red and black tablet because these are the symptoms that we're experiencing," and the pharmacist will give them. However, they will go back 2 weeks afterwards and they will say, "I'm still getting this burning. Could I get some more of the red and black tablet?" What is actually happening is that the medication that they're using is not effective enough to kill all of the germs, the bacteria that is there. And unless you have examine, test done, like a urine analysis, you see a physician who will be able to guide you as into the different types of antibiotics and the choices that may be best suited for you, then you'll find yourself with a repeated. And I know Dr. Kizio had brought this up a bit earlier in terms of resistance. And this is something in Guyana we have to be very, very careful when we look at it, because not only antibiotics, but there are other medications as well. And for example, you have the malaria tablets that persons may just go to the pharmacy in the interior and they may say, "Okay, I think I got malaria and I just need to get this tablet." And you find that Guyana has started a path whereby we need to really look at resistance and how we're going to treat it. So it's advisable. Go to the doctor, let the doctor see you, diagnose you, and give you the right treatment.
Well, thank you very much for that, Dr. Neil. I guess what you're saying to us, we shouldn't attempt to play a doctor on ourselves. I mean, the only time we should come anywhere close to playing doctor is when as we're doing what Robert said before, when we notice changes in our bodies, when if we're women, when we're doing self-examinations. I guess that's as far as we should go, but then leave the rest to the medical experts. So I think we hear you loud and clear, right? But as I mentioned, the whole concept of self-examination and for breast cancer, I know there's another cancer that affects women, cervical cancer. What are some of the signs and symptoms of that?
Cervical cancer, like all cancers, and I want to start by saying that any part of the body can get a cancer. Eyes, ears, the nose, the lung, the kidneys, the liver, every single part, the skin, can have a cancer. But the cancers that are familiar to us are the ones that are most prevalent, meaning these are the ones that happen most often. Most often, they occur most often. And one of these is cervical cancer. Specific symptoms, now at the top of the list for any cancer, symptoms is asymptomatic. You get no symptoms. You do not know until it's too late. Some other things to look for, and these are things that happen when the cancer is advanced, are things like bleeding from the vagina, pain to the lower abdomen, pain during the sex act, loss of weight, loss of appetite, fatigue, tiredness, headache, and these are general symptoms that happen with any cancer and also other diseases. When these appear, it's often times very advanced, and that's why it's very important that we get checked ever so often after you have passed the age of 21 to 25, or after you have had your first sexual encounter. Then women, you need to get checked. And how do you do this? You visit your local health facility. Most of the health centers, they have days when they do the VIAs, and that is a screening tool that we use to check to make sure that your cervix is healthy. There is also the pap smear that can be done, and that will be recommended if they find anything on the VIA. But it is important that you get checked because I cannot stress this enough. One of the top symptoms for cancer is that there is no symptom until it's too late.
Well, thank you very much for that response, Dr. Kezia. It makes me wonder because I knew someone quite recently who was diagnosed, well, found out very late that they had colorectal cancer. And that person was living quite comfortably and didn't even seem to know that they had it until, unfortunately, it's too late. And I keep hearing you have been stressing, all three of you as doctors have been stressing the importance of us doing regular screening and having ourselves checked out. So I think that's certainly very good advice. Now, one of the things I wish to, I know we've been talking a lot about diseases that affect adults, but hey, we weren't born big, right? How do we care? Let's start talking about our newborns. What advice are you going to give us in terms of care for newborns? Because we all started at that stage.
Yes, indeed, Orson. We all did. And I think it's very important that new mothers, and not just new mothers, all mothers, know how to take care of their newborn. And while it is very, very important to have yourself surrounded by family and people who can support and help you with the care of your newborn, it's also important to know that you are the parents and you have to make sure that the practices that you employ are not detrimental to your child in any way, because we do not want to cause harm. No mother wants to cause harm. And I say this because there are practices that have been passed down through generations. Your grandmother did it and your great grandmother did it, and so that means you must do it too. What I want to say is that we do not discard all the traditions. The good ones can be kept, but there are some that can negatively affect your child. For instance, the newborn from 0 to 6 months does not need any additional food other than the breast milk. And in the absence of the breast milk, because there are cases where the breast milk is not coming, it's not being produced enough, or it's not being produced at all. In those cases, you have the infant formula, and there are varying types of these. One of them is infant. The newborn, the infant from 0 to 6 months, does not need additional food other than the milk, the breast milk, or the infant formula, or the breast milk and the infant formula. Those are the only combinations you should be using. And I say this because it is quite common practice for us to say, let's thicken the feed because it's too thin and the child is hungry. That is not a good practice. And why am I saying this? Because I mean, I probably got it, and my mother and her mother and everybody before us, and I mean, we're all alive. But guess what? that predisposes you later in life to things like we have just discussed, diabetes. Your baby at that stage is not ready. The gut, the stomach, it's not ready to accept anything other than those two things I stated before. And in doing that, you put the child at risk for worse things than diabetes later in life. They can become malnourished. And malnourishment can lead to hospitalization and in some cases death. These are not things we want to see or we like to see. And it might not have happened to you and you received the barley flour and the plantain porridge before 6 months, but it can happen and it has happened. And so these are things that you do not want to do. Another practice is using, and we like to use a lot of things, sweet smelling stuff and so on the skin, but baby skin is very, very sensitive. So we want to be careful what we use, what we use for baby skin. We don't want to use harsh products like Dettol in the bath water because we think it will keep baby clean. That will be detrimental. And I just wanted to touch on one last thing, vaccinations. Vaccines are important for your child's health. It helps to protect them and it gives them immunity from specific diseases. So it's important that the child be vaccinated at the appointed times.
Well, thank you very much for that. Thank you
Excellent.
very much for that.
Yeah.
Vaccination. That has been a very hot topic recently, and a lot of us seem to have forgotten that we used to be vaccinated as children. And can perhaps what I would ask the doctors, if you can at the moment, quickly remind us of some of the approximate ages when we get different doses of vaccines, because I know sometimes we get them at about six. We have one course at about 6 months, then another time at nine, and I know even into our, what you call it, our young childhood and adolescence, we still have to have some follow up. I think they call them booster shots, but of course now people don't believe in some of these things. So can you give us an idea as to what was the regimen that we as adults would have gone through as children when we were vaccinated in school?
I know there's a lot of hullabaloo about the booster shots that we don't want to get now. But a lot of your vaccination in childhood is booster shots. So vaccines are given at birth. You get two vaccines at birth. You get your hepatitis B and you get your BCG. And the BCG happens in countries that you have tuberculosis endemic, countries like ours. In other countries like the US, they don't give that vaccine because it's not necessary. You get vaccinated at 2 months, and at that vaccination, you get four. You get revaccinated for those same things at 4 months, and then revaccinated at 6 months for those same things. You get vaccinated at a year, and you get booster shots at 3, 9. You also get vaccinated now between 9 to 12. This is where they gave the HPV vaccine. And we were talking about cervical cancer. And this vaccine is very, very, very important in preventing that cancer. So it's important that you get your children between 9 to 12, and this includes boys and girls, vaccinated for with the HPV vaccine. You also get vaccinated at 15 because you have to get your repeat tetanus shot. Right? So these are the vaccines you get throughout childhood. And for children who have other illnesses, for example, for children who have heart disease or kidney disease or things like sickle cell, these children, their immune system is a little more compromised. And so they would need some other vaccines, some additional vaccines. And these are provided for them as well.
Thank you very much, Dr. Kizia. I mean, there's so much good information that has been shared this evening as it relates to family health. And I am what I'm hearing from our medical professionals is that health is the everybody's business, particularly in a family. You know, it's important that we work together as a family to 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 manage and in some cases overcome these challenges that we face as a Christian body. One of the things, a question I'd like to throw to the our medical professionals is we believe in healing, and you know, what would you say in a case where we've gone to a healing service or we experience a miracle, but we're on medication. um, how do we I know I am aware of cases where people they thank you Jesus I'm healed and they done with the medication so to speak. I believe that how is that a correct approach? Yes, we believe that God can heal every disease, everything, because he made this body. But is that a correct approach to have you experienced the healing and you no longer want to deal with whatever treatment you are given to? How do you deal with something like that?
All right. This is how I'll answer this question. We're at home. You had a fan on. Your fan stopped working. You carry it to a technician. The technician fixes it. The only way you can know for sure if it fixes if you carry it back home and you plug it in to see if it works. I like to look at it the same way, of course, and I strongly believe God can heal anything. There's nothing too hard for Him to do. There's nothing out of His reach. Once you take it to Him in prayer, find to His will, He can heal. He will heal you. Where medicine comes into play, and you would find even a lot of persons they'll pray for you, and they'll always end it by saying, "Go back to your doctor. Have them check you out." This is the proof that you will get. It's that and it's as simple as that. I dare say also, um, you can be healed through medicine. I personally believe God would have given us, by us I mean persons in the medical field. I know you may come across persons who may want to play to their God. Of course, not talking about that, but we are given the ability to understand the human body. And I believe that through us, we can be used by God as well. There is a place for miracles, like stated before, but it's always good to come back to and to get checked out. Doctor sign you off with a clean bill of health. You can that is a miracle in itself. That's a testimony in itself. You can have physical exams. For example, you may have a radiology study done before showing you got a tumor growing. You go back to the doctor orders the same test again, tumor gland. You have the proof to show persons that you come into contact with. This is my testimony. This is what I had before. I submitted to God. He healed me. This is my new results. So it's healing and the belief that God can heal you in any situation you are. Of course, there is a place, and it's something that we 100% endorse.
Oh, thank you very, very much, Dr. Bob. Um, oh, unfortunately, our time is really catching up with us, but I like how you have put a nice cap on it there. And I'll invite you, all three of you, just now to make your final closing remarks. But I like that point that you made just now, that this is a combination thing. Yes, we know that God can heal. We're not discounting that. As a matter of fact, God is also healing you through the doctors. It's not a case where God is divorced from that process when you go and take medication, because who gave the doctors the wisdom? It's the same God that gave the doctors the wisdom. So it's not to say that we are saying don't trust in God or don't trust in the doctors. It's a combination and they work together. So I think that point that you made just now, Dr. Robert, was clearly well articulated, and we accept that. So I'll invite you in, starting with Dr. Neil to make your closing remarks, and then we go to the Doctors Lee and Doctors Lee. That's Kezia and Robert. So Neil, you first.
All right. Thank you very much for this very interesting conversation. I must say that for me, I think we need as family, I should say immediate family, extended family, to really look out for one another. We've talked and we started the conversation by talking about the well being of a person. And just want to highlight 5 things that I honestly and truly believe can help a person to really push to becoming happier and becoming healthier. And the first one is connect. You connect with persons around you. You talk with them. You share advice and you receive advice from persons. You become active. Number 2, it's not about just being at home and sitting in your little corner. Every time you go out and you exercise, you release stress and you become even more happy. You learn as well. You learn from other things, from experiences that other persons go through. And this can also boost your ability to handle any kind of situation and to become a better person and to become a better support. And fourthly, give. Now, we are accustomed to receiving, but sometimes we just need to give, and that helps us to feel a little bit more involved. And the last point that I want to bring out is notice. Keep your focus about things that are happening around you. It is not you alone. You have your family, you have your friends, you have your loved ones that are there for you.
I just want to sum up by saying it's a reiteration of what has been said tonight and what we started with. Each person in your family is important and their health is important. As Dr. Robert said earlier, invest in your health.
It's a really good investment. Can't go wrong with it. Invest in good health.
Thank you so much, Dr. Kizia, Dr. Robert, and Dr. Neil for sharing this evening. We have been challenged. We've been also inspired by your sharing your knowledge with us on many issues that affect us as families. And health is very important area that we cannot ignore. And one of the clear things here is that there's some cultural things that we need to put aside. And I like the way Dr. Kizia put put it together. There's some good. We can keep the good, and the not so good we will leave that alone. Thank you so much for tuning in this evening. We appreciate all of our viewers from Guyana and the world at large. Thank you for being a part of our Wednesday presentation on family health, and we look forward to seeing you again in a not so distant future. Good evening and good night.
Who am I that the highest king would welcome me? I was lost, but he brought me in. Oh, his love for me. Oh, his love for me. Who the sun sets free, oh, is free indeed. I'm a child of God, yes I am. Free at last, He has ransomed me. His grace runs deep. While I was a slave to sin,